Listen to the News Extra, the News Extra on Radio Patches 94.5 FM.
We hear about electricity, and the nearest that we can see functional electric pole is one day.
All the preterm babies we get here, we refer them to our, and yet we have the machine, but the machine is not much.
Without have power in the OPD, outpatients, now it makes OPD to work only 12 hours, not now 24/7.
The News Extra on Radio Patches 94.5 FM.
Omugo Health Centre IV is the main hospital in Terego district, one of the busiest health facilities in the region. This health center is equipped with latest medical equipment donated by Ministry of Health and implementing partners in the district. It serves as a referral point and offers services to both local and refugee population in the district. Although the facility has medical equipment and personnel to handle several cases, including operations and emergency services, many patients are always referred to a rural regional referral hospital since the facility lacks power to run these powerful machines. The referral is a strategy to save life. 2 hours journey from Arua along Terego district's main road, damaged by rain, lead us to Omugo Health Centre IV. The rain, as usual, is a problem at this facility since it covers sun that helps to charge batteries using solar systems as the main available source of power to run the whole facility. The chairperson of Health Management Committee in Terego Sub-District, Rashid Gogo, explains that power is the major challenge faced at Omugo Health Centre IV.
Without have power in the OPD, outpatients, now it makes OPD to work only 12 hours, not now 24/7. During night hours, they cannot now work. If they are to work, they will all come and then maybe work in patients. So it affects the service delivery in OPD. Because ideally, before you go to inpatients, you are supposed to go to OPD, outpatients. Then you are checked there and then you are given admission from OPD. So now it has made the work in OPD to be a little bit very difficult. Then theater cannot work without power. So when there is no power now in theater, it will make us to refer the patients to regional referral hospital. That is in Arua, which is also very far from here. Sometimes there may be no fuel for the ambulance. So it will force us to sometimes also ask the patients to look for transport to take their patient to referral hospital Arua. We are using solar when the weather is not good, when it rains like 2 or 3 days consecutively, to find there will be no power here completely. When it happens, sometimes, especially the midwives, they use torches for delivery. Even they use sometimes their phones to light to deliver patients. That is the challenge we have here.
Omugo Health Centre IV on average registers 300 patients in the outpatients department, 40 at inpatient department, between 28 and 30 in maternity ward for delivery. Every patient admitted here and their guardians comes with torch or phone to provide light at night. This is simply because almost all the departments, including maternity wards, many times do not have light. And the situation is even worse when it rains for a long time. The facility only relies on solar system for lighting and running the machines available in laboratory, theater, art clinic, and maternity wards. A walk inside maternity ward at 8 p.m. confirms darkness, while several machines in different departments lie idle. A nurse at this facility narrates that an incubator brought about 2 years ago cannot be put in use.
They are supposed to be kept here until either they wait that they get or until when they reach a better gas station. Cannot run with the current show. All the preterm babies we get here, we refer them to our, and yet we have the machine, but the machine is not much. They were brought here last year, June. They're just here dormant. We have not been using them.
Other medical equipment and machines donated to this facility include refrigerators to store blood and a diagnosing machine. All these and many others lie idle due to inadequate power to run them. The Ministry of Health donated a generator to the facility, but this equally lies idle as fuel in it remains a challenge due to lack of budget. Terego District Health Officer Simon Amandi is aware about the power challenge at this facility, but he has nothing more to do in addressing the situation. His call is to government.
We use torch sometimes. We don't have adequate number of solar panels. Really, lack of power in the health sector is a major cause of death. There are some machines which we need to use for neonatal care in the labor suit. We need light. Even some equipment needs to be used we need power to drive them. In the whole of Terego, we don't have actually power. This cable connectivity. We see poles, but there is no electricity. So Terego is the most hit because we don't have any switch in Terego. It only stopped in one day, but that was for BAT. Apart from this, we need income generating activities. When people have income generating activities, they can be able to get money in their pocket. Social power of production electricity is one of them. It's linked to health a lot, whether it is wealth, whether it is poverty, whether it is sickness, whether it is death, it's all linked to power. The immediate thing is, I know we have had some solar panels which are supporting to generate some light, but it cannot do the major work of electricity. We also are sure that there is a power line which is actually already being connected along Terego Road, but it's just power pole. There is still no electricity connectivity yet. And therefore, the factor of using electricity, the machines, the equipment cannot get done.
Whereas the call to government for connection of West Nile to national grid gets louder, Terego District is yet to be connected to electricity on the electric poles installed along district's main road with wires. A retired police detective, Sam Andati, who now operates general merchandise, shares his experience and appeal to the authorities.
We have tried our level best to talk or pass our problems through the LC system, 3 up to 5, then above. But I can see only empty promises. Soon it became music actually. I can say it is now music. That power is soon coming. Power is soon coming. A week, months pass, years are going now. Still nothing. So I don't know. Everything is installed now, is in place, I can say, especially the poles. The wires are all fit. I just don't know what is happening. We have prepared ourselves to install wiring system or this and that. But there is now weakness because we may spend the little we have, special wires, they need about 0.7 to wiring system within here. You may the little you may spend and then nothing happens. So I prefer that about 0.7 to do it maybe in the darkness or otherwise. Sell my mandazi, sodas, other than now spending it on electricity, which I may lock and nothing happens. I would be so grateful if this problem could be really uplifted for betterment.
Terego District Chairperson Wilfred Saka says the absence of power is affecting the economy of the district and other services.
First of all, we hear about electricity, and the nearest that we can see functional electric pole is Wande, which is about 20 kilometers away from here. So the district is in complete darkness. You have seen poles that are stringed, but there is no power on them. That's where the problem is. But the truth be told, this power is, we have waited for it. We have really waited for it. It is not forthcoming, and it is hurting the economy. This has been the history from time immemorial. We had high hopes that the electricity pole had already reached here. The stringing had been done. We knew power was coming. It has not come. We will continue to wait.
Omugo Health Centre IV management reveals that it has records of death cases due to lack of power. One was a mother in theatre who underwent cesarean operation, and another, a child born prematurely. Rain still remains a major fear of management of this facility because it gives nothing but only darkness at Omugo Health Centre IV, since batteries cannot be charged. My name is Sabir Musa, and this is News Extra.
The News Extra every Friday on Radio Patches 94.5 FM. Peace of Christ for all.